Thank you for our interest in our residency program. We look forward to telling you about the kind of resident we are looking for, what makes our program stand out, including how some of our very own residents have stayed on as faculty.
We have a great track record of training residents to be competent, capable pathologists who pass their boards and get great fellowships. Our residents are wonderful people who get along well together, and it is important for me that this collegiality continues. All that is required on the resident's part is being willing to do the work that it takes to become skilled in pathology and having a good attitude while doing it. We will take care of the rest.
One of the best ways to enhance your learning as a resident and ensure your confidence moving forward is to see as many cases as possible during your training. This includes both bread and butter specimens and statistically rarer entities. Our residents see with frequency numerous breast cancer cases, GYN oncology, GI specimens, head and neck resections including larynx and thyroid, lung resections, kidneys, brain tumors, and so much more. At Orlando Health, there's no surgical subspecialty that is not very well represented. Our residents have the luxury of having an overabundance of cases to learn from. Plus, there are more attending pathologists than there are residents in the program, all of whom are happy to teach at the scope during sign-out, frozen sections, and of course, conferences.
I chose Orlando Health at the recommendation of a mentor in my undergraduate and medical school class who thought that the diversity of cases and the breadth of training here would suit me well in my career. And I believe that that was the case. The breadth of experience that you are afforded here through greater than 1-to-1 ratio of attendings served me well when I went out into fellowship and during my practice back here at Orlando Health. Every day you might look at all aspects of the human body in our surgical pathology rotations. The same goes for our autopsy rotations, where we have private practice, pediatric, and in-hospital autopsies, as well as opportunities to participate in research in dementia and other neurodegenerative diseases.
Resident teaching is a priority at Orlando Health. Our program currently consists of 10 residents and 13 full and part-time attending pathologists. All of our attendings are skilled general surgical pathologists, each with their very own subspecialty, covering all major organ systems. The residents benefit from a 2-day sign-out schedule, 1 day of grossing followed by 1 day of sign-out. In the gross room, the residents are overseen by experienced pathology assistants, senior residents, and of course our attending pathologists. Also here, residents become proficient at cutting frozen sections. On sign-out days, cases are reviewed at the attending microscope, allowing for individualized learning directed at each resident level. As the residents become more senior, they are encouraged to participate in graduated responsibility, including ordering and interpreting stains and dictating reports prior to final review. Lastly, residents participate in daily didactic lectures to cover all anatomic and clinical pathology topics. It is important to note that the residents' time is completely protected during these lectures.
This residency trains you very well in what to look up, where to look up information, what colleagues to go to get help in, and what cases you will need help in. The faculty made it very obvious and very clear that saying that you don't know something is just as admired in their residents as knowing what you do know. And knowing where to get information to fix those gaps is what they teach you and what they admire in you the most.
It is a pleasure to work here at Orlando Health with our exceptional team. We wish you all the best in your search for the best residency program for you and hope to see you soon in sunny Central Florida.